Senator Seidman.
Thank you, Chair, and thank you all very much for your presentations. I'd like to address my question to you, Mr. Colbert, but I'm sure, Madam Granger, you might like to respond as well, given your presentation, and anyone else, of course. So, Mr. Colbert, we've heard a great deal of testimony this week about the need for some kind of limit on the THC potency of cannabis, given the known association between higher potency products and mental health risks. I noted in your organization's response to Health Canada's consultation on the proposed approach to the regulation of cannabis that you said, and I quote, "The establishment of maximum THC levels for selected products is viewed as one means of assisting individuals in establishing safe consumption habits. As such, CPHA supports these limits. It is noted, however, that no maximum concentration of THC has been established for dried or fresh cannabis. The association's view is that the limits are necessary as a means of maintaining a consistent product for consumption, thereby helping to reduce the likelihood of overconsumption." End of your quote. So are you concerned that the government has not provided, as of yet, any indication that it will establish a maximum THC concentration for dried or fresh cannabis? And can you tell us more about how the establishment of maximum THC levels can help people establish safe consumption habits? Thank you.
Yes. Thank you, Senator, for the question. That is our position. We would have liked to have seen maximum THC concentrations in the regulation. We understand, and it's a difficult position for us to be in. Our advocacy is evidence-based. Unfortunately, there's no evidence to indicate what that upper limit should be. And that's an area where, under legalization, more research will be allowed, and we should be able to set that in the future. It's one of those situations that we're finding ourselves in. The cart is slightly ahead of the horse, but unless you legalize, you can't do the research. So we appreciate that. As is outlined in the lower risk cannabis use guidelines, the goal is to have people start as the lowest possible THC concentration possible, so that they can kind of adapt their usage. It's not like first time a young person has a drink, they go to Scotch necessarily. You ease someone into it so that their body can adapt to it.
If I could just,
Yep.
I'm sorry, I don't mean
that's
to
quite
be
all right.
rude, but if I could just interrupt you, because I'd like to quote something that you just said to us in your
Sure.
presentation. You said the interests of the private sector, that profits from the manufacture and sale of cannabis are rarely aligned with the interests of public health. So, and that's absolutely right. I think we would all agree with that.
Correct?
And so I appreciate that there isn't scientific evidence for the maximum limit, but I would assume that one can say that 30%, we've heard repeatedly from psychiatric experts, medical researchers, that 30%, for example, is an extremely dangerous level of THC. So would you not say, even though we don't have, controlled trials as a gold standard, would you not assume, if we're really going to have a public health approach here, that we should have some regulations that are very clear on a maximum level?
Absolutely. Our original paper on the document, on the topic, called for a maximum limit of 15% with exceptions for medical purposes if there was extenuating circumstances. I was simply stating, I understand why the government hasn't. They've tried to take an evidence-based approach, and there's no evidence to support that limit.
But there's evidence to support 30% as a...
Certainly, we know those higher concentrations are dangerous.
Okay.
Only got a half a minute left.
Okay, so maybe Madame Granger might have.
J'ajouterais simplement...
Just simply want to say that tax that should also be part of the concerns that you've raised. In terms of beer, the alcohol rate of 5 to 7%. There are also 0% beers, and then we have the wine and others. So to complement what should be said. There should be taxation. So it'll be tough to find what percentage this is, but of course, products at 90% levels should not be authorized, as I said. There's another very important aspect in terms of coherence. That's the tax aspect. Starter products should be not as dangerous. Okay.